Hello, good afternoon. It's Wednesday, March 6th, and this is Dr. Scanterbury coming to you live from Delaware, from Dialysis Patients Citizens Educational Center. This is the Ask the Doctor session, and so I invite all of you to join in and ask your questions for the month of March. We celebrate World Kidney Day, which is coming up next week. This is Dr. Scanterbury, and today is Wednesday, March 6th. And welcome everyone to this Ask the Doctor session. And I hope many of you are ready and willing to send your questions in so that we can have a discussion. What have you done lately? How's your dialysis going? Are you having any trouble with getting on the transplant list? How are you doing post-transplantation? Is everything going well? How many years out are you? Do you know anyone who may be suffering from kidney disease, who may need more education about the process? Oftentimes we don't share our story, but for March, which is Kidney Month, this is a good opportunity for you to share your story, because you don't know who you may impact and who you may help. And there are so many people out there who are not aware of kidney disease and the fact that it does not necessarily have a lot of symptoms. Fortunately, so many patients feel that because they're making urine that the kidney is just fine, but we all know that unfortunately kidney disease is silent. So for this month, the month of March, kidney disease, share your story. If you belong to a community center, if you belong to any place of worship, it's a great opportunity to educate others about the crisis and the significance of knowing your numbers, understanding your risks, understanding that kidney disease is silent and you may not be aware of what's going on. So this is an opportunity for you to be an advocate and for you to really help others, because so many people may not be aware. So if you don't be ashamed of the fact that you're on dialysis, don't be ashamed of the fact that you haven't had a kidney transplant or you have kidney disease, because this is something that you could not possibly have prevented. As we know, the many leading causes of kidney disease, most people are not aware of the fact that high blood pressure and diabetes affect their kidneys. And often for kids, it may be chronic infections, it may be stones, it may be so many other things. So making people aware and also sharing your journey, whether it was difficult or whether it was smooth, others can learn from that, knowing how to navigate the system, what to do after you're diagnosed, how to really push your doctors in asking those sensitive questions, making sure you understand what the doctor is saying. That is so important, because oftentimes we sit there as patients and maybe not comprehend what the doctor is or the healthcare provider is telling us, or they may be speaking in medical terminology that you don't understand. But please stop them. Say, can you tell me that in simpler terms? What does it mean? And why am I going through this? Or what can I expect? So many times we're not given enough information to understand what is your journey, what to expect, and what are your choices. What happens if I choose this, and what happens if I don't choose this? What are the alternatives? And that becomes crucial, because you want to know whether or not you're making the best choice for yourself or the best choice for your family. And that becomes important because you need to understand what those choices are. Even if you're just given one choice or give one solution, you may say, are there other options out there that I should be considering? And what are those options? And what are the benefits and what are the disadvantages? So as we go into this month of March, which is Kidney Month, you'll probably find that there's much activities and really centered around highlighting kidney disease, and also in terms of talking about the causes of kidney disease. This is the time to get involved with any community screenings that you may have in your area, so that you can also lend a helping hand. And even if it's something as simple as blood pressure screening, getting people to be aware of asking someone who may have high blood pressure or diabetes, do you know whether or not you're having protein in your urine? And are you measuring that protein in your urine? Because, your creatinine may be normal, but understand that there are the silent signs of kidney disease that is often not addressed. And so important also to remember that if you have loved ones in your family, and also to tell others that, especially those who may be elderly, or parents or aunts and uncles, to have someone go to the doctor's office with them. Because many times these patients may not understand what's being said to them, or they may be intimidated by the healthcare provider and may not necessarily ask the right questions. So it's upon us to really participate in the care of our loved ones, and make sure that there's someone who is able to accompany them to the healthcare provider's office, so that they can listen and they can ask those questions, and they can begin to understand what they need to do to keep healthy. If someone is just going through stage 4 to 5 and they're not ready for dialysis, they may not necessarily have gotten there, but they want to make sure that they understand what things can make their disease worse. What can I do to improve it? What foods should I avoid? What things are important for me to consume? And so those are important aspects to understand. So I welcome everyone today. Be sure to put your questions in the chat. Thank you all for joining. And it becomes important to really focus on how you can keep a healthy lifestyle. And even in terms of avoiding foods that are high in potassium. You know that as your kidney fails, it makes it difficult, so you hold on to more potassium. So you have to be careful with potassium-containing foods. You have to be careful with foods that are high in phosphorus, because those aren't necessarily, phosphorus isn't removed easily, and so you might have to take binders, or just limiting the amount of foods you consume that may have phosphorus. So the first question we have is, how high before a patient begins dialysis? And you have to remember, when you think about how high is creatinine, when you think about creatinine, and for each individual patient, that may vary depending on your body mass index, whether you're male or female. And when you think about starting dialysis, it becomes in terms of symptomatic. Generally, most people go by how you're feeling, not necessarily a certain number. A creatinine may not necessarily reflect whether it's time to start dialysis, but if you have, generally the nephrologist will get quite anxious once your BUN, which is a signal of you becoming more and more uremic, once that BUN starts climbing near to 100, and definitely when it's over 100. So that becomes critical, because then we know that your body is not able to excrete those metabolites. And for many people, it may be lack of blood pressure control. Despite all the medications, they're not able to control the blood pressure. They're not able to get enough fluid off. Some people are so fluid overloaded despite the diuretics. They cannot get the fluid off. And once that fluid starts accumulating in your lungs, making it difficult to breathe or difficult to lie down, you may still be urinating, but you have to remember, it may not be your volume that your kidneys need to excrete. And those metabolites will stay around your body, which may jeopardize your heart. So generally, it's a matter of what other things are in danger. And so the biggest issues are your blood pressure easily controlled or controllable with medication? is your weight. If you're terribly fluid overloaded and they need to take off fluid that's not working with the diuretics, then you don't want someone to end up in congestive heart failure because they're not able to get that extra fluid off because the kidneys aren't working. So that becomes a major point. Oftentimes for potassium, some patients may require dialysis because their potassium is way off base. There are many medications that can be used now to control potassium. And so oftentimes they can add these medications to a person's regimen to help keep that potassium under control. And so that may not necessarily be one of the indicators unless it's an acute elevation in your potassium and you're seeing and your potassium is now 6.8, close to 7, on over 6.5, then they may try with some medications, but that can often be an indication that dialysis needs to begin, even if it's temporarily. But the biggest issues are generally having to do with your BUN or your metabolites. So in terms of how uremic you are, oftentimes patients will get very sleepy and tired, unable to function because they're so uremic, and the waste products that the kidney would normally excrete are now being accumulated in your body. And when you think about your creatinine clearance, if it's 10%, that means 90% of your metabolites that your kidney should be excreting are now accumulated in your body, which can add injury to your heart. It can add injury to your brain. Most patients are not able to think straight. They're forgetful. Their family don't understand why they're acting like that. But those things are often signs that you are getting toxic with all the substances that your kidney is no longer able to excrete and are beginning to be stored in your body. So for when you think about the need for dialysis, it's not just a number itself, but it's really about what's happening to the body, and can the side effects of your kidney dysfunction be handled with medications or adjustments in your diet and your overall regimen. So that's crucial. One of the side effect of consequence of renal failure is anemia, because your kidneys make that erythropoietin, which is that hormone that's necessary to keep you making enough hemoglobin and keep your oxygenation up. So without good kidney function, you will need to be supplemented with an injection, which is generally given as an injection if you're not on dialysis, but if you're on dialysis, it's generally given in the dialysate machine, so you not necessarily have to receive it yourself. And that's given routinely to maintain your hemoglobin over 9, because that becomes critical when you are constantly anemic, because that can add more to your fatigue. When you don't have enough hemoglobin, then you tend to breathe faster because your body is saying, I need more oxygen, because you don't have enough oxygen carrying capacity. So those things are just side effects of renal failure consequences. And so the nephrologist will generally look at all those things to make sure that you are ready to begin dialysis. And oftentimes there's preparation for that. You get your education prior to that if you are being followed in stage 4, before you get to that point where you talk about what are my options for dialysis. Is it going to be hemodialysis? Is it going to be peritoneal dialysis? And it's a scary time because it's a major undertaking. And also the idea of, can I go straight to transplant if I have a living donor who is going to donate to me? So those things are crucial. And it's so important to be able to have that diagnosis not in the emergency room when it's acute, because many patients are not aware of the site of what's happening to them, because they feel that this shortness of breath and this other things that are occurring may be due to just fatigue. And until they end up in the emergency room, then they are acutely ill with high numbers and need to be dialyzed. And so early diagnosis is very important, so you can understand your choices and even entertain the idea that perhaps you can go, you can skip dialysis if you have a family member or friend or someone within your circles who are willing to be a living kidney donor and can donate to you. And if that person doesn't match, remember, if they're not compatible by blood type, you can enter a peer donor exchange where that person donates to someone else in the algorithm, and you get a kidney from someone else, and everyone wins. And oftentimes that can occur as a chain, where someone can, you have multiple people who are willing to interchange, and as a result, not just two people get, one person get a kidney, but 3 or 4 or 5, because that donor who stepped up is willing to enter a chain and allow that domino effect to occur, where your kidney, you may be in Nashville, Tennessee, and your donor didn't match, but it matches someone in Nebraska, and Nebraska's donor goes over to California, and California gets that kidney and send their donor back to Nashville, Tennessee, and you end up with a kidney because all of these donors are willing to enter the paired donor match. And so for every donor that steps forward, even if you are intended for one recipient, the idea of helping many others by entering the chain can allow so many others to benefit. So that is the idea. And I know I've been talking on and on, but welcome all of you who have just joined. I'm Dr. Scanterbury, and we are on the Ask the Doctor here on Instagram for Dialysis Patient Citizens Educational Center. So be sure to ask some questions. We're talking about this being March, being Kidney Month, and how important it is to share your story with others, because even if you help one other person understand that they may be at risk, so that the next time they go to their doctor, they can say, "Doc, I have high blood pressure, I have diabetes, what is my kidney function? And am I excreting protein that is abnormal and above the expected range? And so what is my overall, what we call EGFR, estimated glomerular function rate, which tells me what percentage is my kidney working?" And that puts you in a stage. If it's working at 80%, that's great. If it's working at 40%, that may not be so great, but it depends on your age. If you're 75 years old, that may be okay. But if your kidney is at 35 to 40% and you're under 50, you want to be careful. You want to know what's happening to my kidney. Is there something going on? And so those are things you want to bring to your doctor's attention, and you want to follow on. You want to be your own advocate. You want to make sure that you are following your numbers. Just like you want to know what your blood pressure is and what your cholesterol is, you want and should know what your overall kidney function is. What percentage is it functioning at this year compared to last year or 2 years ago? Is it staying the same, or is it deteriorating? And if it's getting less and less, what does that mean for me in 5 or 10 years? And what do I have to expect? And how can I change that? How can I maybe slow that down depending on the cause? What do I need to control? So those are important aspects of advocating for yourself, finding out what your numbers are, and asking more questions. Asking those pertinent questions is such as, what can I do to help? What can I do to make this better? And so that becomes a very important aspect. So as I said, this is Ask the Doctor session. So please put your questions in the chat so that we can have a conversation about how you're doing on dialysis. How are you doing since your transplant was performed? Are you still waiting for a kidney? And how long has it been? Have you gotten called? Many patients get called for their kidney and are quite disappointed because it does not work out. And that may be because something may have happened with the donor. You may not necessarily be the first person up, but you are asked to get ready because you may be number 3 or 4, and there may have been 2 people ahead of you. Now, if one of those two people or both of those two persons ahead of you decline the kidney, may be sick, are unreachable, the reason why you're asked to prepare is because you may well move on up the line for that particular donor offer, because those ahead of you were not able to get that transplant because of reasons that may not necessarily be explained to you because of HIPAA rules. But don't get discouraged if you've been called several times and it didn't work out, because the plan, you may not know what the God Almighty plan has for you, but it will happen. It will happen hopefully in due time. So continue to keep yourself healthy. It becomes important that while you're listed for a transplant, you keep up to date with all the things that you need to get done. Make sure you're going to your cardiology visits. Make sure you're using your CPAP machine if you have sleep apnea, because your transplant centers are going to be checking your numbers to make sure you're compliant. Make sure you keep your phosphorus in check, because if your phosphorus is out of whack, that's a sign that you are not either using your binders or your diet is too extreme in high phosphorus. And remember, one of the things we see from year to year with our patients whose phosphorus becomes abnormal or is constantly abnormal, you see more and more vessel disease and hard plaque accumulation in the blood vessels, which for some patients make it ultimately become the issue of not being able to get transplanted because of that atherosclerosis. So control of phosphorus is very, very important, because it does build up in your system over time. And even for many patients over years of dialysis or time on dialysis, over time you will notice that your skin color becomes much darker. And that's often due to the accumulation of excess phosphorus. And after transplant, many patients will find that with the phosphorus being cleared by the new kidney, after a few weeks, their skin color begins to change over time. So that is a crucial aspect of being compliant, or making sure that you take those binders. I know they're big and they're difficult to swallow, but be careful with your intake. Be careful with limiting those things that are high in phosphorus, and take your binders, because that can be one of the things that cause many patients to be removed from the list, because their blood vessels are no longer accessible to having a kidney implanted, because they are too hard and the calcium accumulation has gotten extreme, and you worry about what we call propagation of some of that plaque down the leg, leading to injury, thrombosis, and loss of limb. And so that's not something we want to entertain in terms of having a kidney. So in terms of loss of limb. So we do not want that to occur. So it's very important that you stay up to date with your electrolytes, keeping your potassium in order, and your phosphorus within normal limits. For those of you out there who've had a kidney transplant, we're coming down, probably about 5 minutes left. I hope you're doing well. Making sure you take your medications. Remember, if you have a kidney transplant, those anti-rejection medicines you're taking, they act to cloak your kidney. So protect it from your white blood cells, recognizing that kidney as foreign and attacking it. So your medication is almost like they cloak and keep your kidney masked, so it's not discovered to be a foreign entity and get attacked like any other virus or bacterial infection that you would normally end up having. So missing your medicines, unfortunately, if you skip your medicines, if you forget your medicines, you weaken that barrier that protects your transplanted organ, your transplanted kidney. And as a result, your white blood cells or your killer cells suddenly say, oh, I didn't see that. How come I missed this kidney? And before you know it, your white blood cells are invading your kidney and you're having an episode of rejection. However, for many people, it may not be noticeable because you're urinating the same, you feel the same. Most rejection episodes do not carry symptoms unless you're very severe rejection and you stop making urine, and that's very, very unusual. So it's important for you to understand that you have to take your medications, and besides that, get your blood work. If you feel like you're not yourself, I know many patients who are out many years and may not be getting their blood work except for every 3-4 months. That's not good because something happens with your kidney. It may not be recognizable. You may have a slow rejection occurring, and by the time you have your blood work, it's now too far removed to be treated. So it's important to understand that you need for you to get your labs on a regular basis. The further out you go, the more they will expand it to monthly, to every other month. And unfortunately, I think there are some patients who are only going every 3 months. I don't advocate for that, but if you're doing well on every 3 months, that's fine also. But you want to make sure that if you don't feel well, you catch a cold, you others are sick and you feel different, that you get your blood work checked. Don't miss that opportunity because your creatinine can change long before anything else is discovered, and you will not know what is going on. There are many tests out there now that you can do to look for cell-free DNA that looks to see whether the population of your donor cells in your system is increasing, which occurs when there's any inflammation, when there's rejection, even with things such as BK virus or CMV may cause us increase in these cell-free DNA. Or if you're even developing antibodies to your kidney, that can often be detected, and if you develop antibodies to that kidney transplant, that may spark a rejection that may not necessarily be something that you notice. So those are important keys to remember. If you're get your blood work regularly, stay on track, because rejection is not symptomatic 99% of the time. So that becomes crucial for you to understand. So I've been doing all the talking. We're coming down to the end of the hour. Thank you all so much. Thank you for saying I'm actually listening to this. I hope you're listening as you're waiting for your labs to be done for your transplant. So for those of you who are doing well with a transplant, congratulations. For those of you who are in dialysis still waiting, continue to keep healthy. Do your update, see your cardiologist, get your colonoscopy, get your mammogram. Stay up to date. If you have an infection, let your coordinator know. You don't want to come in for your transplant and found to have something that will cancel it, but you want to be treated ahead of time so that they understand that your treatment course is over and you're now ready to be transplanted. So it's okay if you're not at 100% perfect, but you don't want to miss that opportunity when it comes along. So if things are happening, when you're hospitalized, let your transplant coordinator know so they can look at what's going on while you're hospitalized. They can continue to follow it and make sure you recover, and they're aware of those things before they bring you in for that transplant. So thank you so much, and I hope I was able to educate some of you. Enjoy the month of March. Advocate for someone else. Share your story. Let people know that kidney disease is a silent disease, and you may not know what's going on. Share your story for others in your community so that maybe one other person may be helped by your information about kidney disease. So thank you all so much for joining today. This was a great session. Thank you for your questions, and have a wonderful rest of the week. So take care and bye.